continue to get what we're asking for. So I'm happy to answer any questions.
Yeah, Jen, are you able to answer some questions about how many COVID patients, critical COVID patients, can the county care for today? How many hospitalizations do we anticipate over the next 12 weeks? And if the pattern we've seen elsewhere unfolds here, how many deaths are predicted?
Thank you for the question, Supervisor Williams. At this time, I did not come with that specific data today. We do have some epidemiology capabilities where we can start doing some of the data to support answering those questions, but I don't have that information in front of me.
So I'm going to maybe defer to the CEO, who with us today does have those numbers. And perhaps another way to ask is 45 critical patients approximately the number we believe we can care for? And if the pattern continues to unfold, might we see 1,800 patients?
Chair Haschak, if I could jump in per Supervisor Williams' request, I'm going to say that Dr. Doohan has really been studying this along with Dr. Flaherty, and I would ask Dr. Doohan to give you her best estimate on these numbers. I think Jen has been exemplary in supporting us. Dr. Doohan?
Yes. Can you hear me?
Yes.
Okay. My best estimate from talking to the hospitals and talking to the emergency physicians is we have the capacity for 45 people to be in ICU beds on ventilators. So if you look at that number that I said, that we would have 1,800 people needing ICU care in 12 months, that's the moderate scenario. That's where we have some slowing down of the curve. And there's another piece of information here that's very sobering, that those people, the people that get very sick with COVID-19 have what's called ARDS, so it's acute respiratory distress syndrome. And this is a condition where the lungs become stiff and it takes a long time to get better. So we're seeing people being on ventilators for 8 weeks. So you can imagine that if you have 45 vents taken up by people who are going to be on them for 8 weeks, we do not have the capacity to respond to 1,800 people needing ICU care in our community. So the question of how many people would die, estimate would be 1,800 people based on how many can get ICU care. Sheltering in place can work. Everything that we're doing can work to turn this curve around, especially because we're doing it coordinated with our region, which has nationally been remarkable, that we've been able to coordinate our entire region. And in that region includes all the way up to Humboldt, because the health officers are now having a rural working group where we're coordinating with the Bay Area. So we can create a firewall with sheltering in place, but it will only work if that sheltering in place truly happens and social distancing truly happens. We have to protect our healthcare workers. This is an absolute priority, and that's what sheltering in place also does, because they're getting less exposures. I will say I'm very pleased that the 2 cases that we have in our county, in both of those cases, the healthcare workers and the clinics participated in the care of the patient impeccably. They wore their PPE, and they did not have exposures because of that. So we are doing a good job also messaging and coordinating with our healthcare partners and with Coastal Valley EMS through the MOOC function with Jen Banks, making sure our people have PPE. And they do. They do. They are being provided by, we hear horror stories around the country, but we do have the appropriate PPE for the people that are caring for patients in our community.